Welcome back, everybody, to another deep dive into today's biggest healthcare headlines.
Yeah, it's going to be a busy one today.
It is. We've got AI advancements naturally.
Of course.
Some workforce concerns, a new player in the radiopharmaceutical therapy space, and even some advice on how to actually enjoy your vacation.
Sounds like a plan. Let's get started.
Sounds good to me. Let's jump right into the world of AI, which is rapidly transforming healthcare. I mean, think about it. Prescription refills in a snap, real-time health advice at your fingertips, and even better management of chronic conditions.
Absolutely, but it's not all sunshine and roses. We need to be cautious about the potential downsides of all this automation.
Such as?
Well, there's some recent research that suggests that relying too heavily on AI could actually diminish our critical thinking skills.
Really?
Yeah, it's a bit of a double-edged sword. AI can make us more efficient, but at what cost? Are we trading cognitive abilities for increased productivity?
That's a really interesting point and something to consider as AI becomes more integrated into our lives. And speaking of AI, there's a new player on the scene that's making waves, DeepSeek AI.
Ah, yes, DeepSeek. This one is interesting. It's an open-source generative AI platform that's designed to be more resource efficient than some of the big names out there.
And I hear it's causing a bit of a stir in the tech world.
It is. Many experts believe that DeepSeek could intensify the competition between the US and China in the field of AI.
So it's not just about the technology itself, but also about the geopolitical implications.
Exactly. AI is becoming a major player on the global stage.
Now let's shift gears for a moment and talk about NYU Langone. They made a pretty bold claim during the Super Bowl with their ad proclaiming themselves as quote-unquote #1 in healthcare.
Bold indeed, but it does raise some questions. What metrics are they using to define #1? What's the scorecard?
It's not exactly transparent, is it?
Not really, and it highlights the importance of critically evaluating these kinds of claims. What constitutes the best in healthcare is a complex question.
Absolutely. Now let's turn our attention to the healthcare workforce, where physician burnout continues to be a major issue.
It's a growing concern and a multifaceted problem. Physicians are facing increasing pressure from administrative burdens, inefficient scheduling systems, and the need to integrate new technologies into their already busy practices.
So it's a combination of factors all contributing to this sense of overwhelm.
Exactly, and it's impacting not just physicians, but the entire healthcare system.
Are there any solutions on the horizon?
Well, healthcare IT leaders are starting to recognize the urgency of the situation and are actively seeking ways to alleviate physician burnout.
That's encouraging. What kind of solutions are they exploring?
One key area of focus is optimizing physician schedules. The goal is to reduce administrative overload and free up more time for patient care.
It sounds like they're trying to find ways to improve efficiency and create a more sustainable work environment.
Exactly. And hopefully these efforts will lead to a better work-life balance for physicians and ultimately better patient care.
Now, while we're on the topic of the healthcare workforce, let's not forget the vital role that nurses play.
Absolutely. Nurses are the backbone of the healthcare system, and it's essential to involve them in the design and implementation of any new technology.
That makes sense. If the technology doesn't work for nurses, it's not going to be effective.
Precisely. When technology is tailored to their needs and workflows, nurses are much more likely to embrace it, which leads to smoother adoption and better outcomes for everyone.
Makes sense. And on that note, there's some great advice circulating from a seasoned ICU nurse who's been in the field for 30 years.
It's always valuable to hear from those who have been on the front lines for so long.
This veteran nurse is offering insights into the emotional and professional challenges of nursing.
It's a demanding profession both physically and emotionally, and having a strong support system is crucial.
Absolutely. Speaking of challenges, the ongoing physician shortage continues to loom large over the healthcare landscape.
It's a significant concern, with projections indicating a potential deficit of 86,000 physicians in the U.S. by 2036.
Those numbers are pretty alarming. What are the main factors contributing to this shortage?
There are a number of factors at play, including the demanding nature of the work, the high cost of medical education, and a limited number of training spots available.
It sounds like a complex problem with no easy solutions.
It definitely is. Addressing this shortage requires a multifaceted approach that tackles the root causes of the problem.
Let's move on to some positive news in the world of cancer treatment. United Theranostics recently secured $15 million to expand its network of radiopharmaceutical therapy clinics across the U.S.
That's great news for patients battling cancer. Radiopharmaceutical therapy is an innovative approach that uses radioactive substances to target and destroy cancer cells.
So it's a highly targeted form of treatment.
Exactly. This expansion could potentially increase access to this promising treatment option for patients across the country.
That's definitely a step in the right direction. Now let's talk about telehealth, which has undoubtedly revolutionized healthcare in many ways.
It's been a game changer in terms of convenience and accessibility, but there's always room for improvement.
What are some of the areas where telehealth could be enhanced?
Incorporating patient feedback is crucial. We need to understand what's working well and what aspects of the telehealth experience could be better.
So it's about making telehealth more patient-centered.
Exactly. Listening to patients and incorporating their perspectives is key to maximizing the effectiveness of telehealth.
On a less positive note, the claims process in healthcare continues to be a source of frustration for both providers and patients.
It's a broken system that desperately needs an overhaul. Hospitals and physicians are increasingly struggling with claim denials from insurance companies.
And ultimately, it's the patients who suffer the consequences.
Absolutely. These denials can lead to delays in treatment, added financial burdens, and unnecessary stress for patients.
It's a clear example of how bureaucratic hurdles can negatively impact patient care.
We need a more streamlined and efficient claims process that puts the patient's needs first.
Now for a bit of a surprise, Meta, the company behind Facebook and Instagram, is venturing into the world of robotics.
It's an unexpected move, but an intriguing one. They've launched a new division dedicated to developing AI-powered humanoid robots.
Humanoid robots, that sounds like something straight out of science fiction.
It does, but the potential applications of this technology in healthcare are quite fascinating.
Such as?
Imagine robots assisting with patient care, performing surgeries, or even providing companionship for those who are isolated.
It's mind-blowing to think about the possibilities.
It is, but it's also important to proceed with caution. Ethical considerations and careful implementation will be paramount.
Of course, we don't want to create a dystopian scenario where robots are running the show.
No, but if done responsibly, this technology could revolutionize healthcare.
On a more practical note, there's a growing trend in the adoption of audio-first smart glasses.
Ah, yes, like Meta's Ray-Ban smart glasses.
Exactly. These devices are gaining traction in various industries, including healthcare.
What's interesting about this trend is the focus on simplicity and user-friendliness. The audio-first approach seems to resonate with people.
So it's about creating technology that seamlessly integrates into our lives without feeling overwhelming.
Precisely. And that's a valuable lesson for any industry that's embracing new technology.
Now, for a topic that touches on politics and its potential impact on healthcare, former President Trump's tariffs on goods imported from China could have unintended consequences for clinical trials.
This is a complex issue with the potential to affect healthcare affordability and access.
How so?
Well, the tariffs could increase the cost of drugs and potentially lead to shortages of generic medications.
So it's a ripple effect that could ultimately impact patients.
Exactly. It highlights the interconnectedness of global trade and healthcare and the need for careful consideration of the potential consequences of such policies.
It's a reminder that what happens in one sector can have far-reaching implications for others. Well, we've covered a lot of ground today, from the exciting potential of AI to the ongoing challenges of physician burnout and healthcare accessibility.
It's clear that the healthcare landscape is constantly evolving, and it's an exciting time to be following these developments.
Absolutely. But with all this innovation and progress happening, are we doing enough to ensure that everyone benefits?
That's the million-dollar question. As we embrace these advancements, we need to be mindful of equity and access, ensuring that the benefits of these innovations reach all corners of society.
It's a challenge and a responsibility we can't afford to ignore. And with that thought-provoking question, we'll wrap up part 1 of our deep dives into the world of healthcare news. Stay tuned for more insights and analysis in part 2.
We'll be right back after a short break. And it raises the question of, are these short-term economic gains worth the potential long-term costs to healthcare?
That's a really good point, something to think about for sure. Now let's move on to something a little more lighthearted, a reminder to all our listeners out there to take those well-deserved vacation days.
Yes, please do. It's so important for both your mental and physical health.
It's true. And try to avoid the whole workation thing, really disconnect and recharge.
Exactly. Make the most of that time off.
Speaking of health and well-being, we wanted to touch on a topic that might be helpful for some of our listeners: exercise-induced asthma.
It's a common condition, but it doesn't have to hold you back from staying active.
Right. There are ways to manage it effectively.
Absolutely. Talk to your doctor. They can help you create a personalized plan that allows you to enjoy exercise safely.
Now let's delve into the evolving landscape of healthcare standards, which are going beyond just clinical metrics.
That's right. We're seeing a shift towards a more holistic view of healthcare quality.
What do you mean by that?
Well, things like consumer engagement and patient communication are now being considered alongside traditional clinical outcomes.
So it's not just about the numbers anymore.
Exactly. It's about the entire patient experience.
And these non-clinical metrics are being measured with the same rigor as traditional clinical protocols.
Absolutely. It's a recognition that the patient experience is an integral part of quality healthcare.
And speaking of evolving standards, the rapid integration of AI into healthcare is presenting some unique challenges.
It certainly is. We're dealing with uncharted territory here, and existing legal frameworks, ethical principles, and governance structures need to adapt.
It sounds like we're in a constant state of reassessment, trying to keep up with these rapid technological advancements.
We are, and that's where robust governance comes in.
Governance meaning,
Healthcare organizations need to have the right processes, policies, and training in place to ensure the safe and ethical use of AI in medicine.
so it's not just about adopting the technology, but about using it responsibly.
Exactly, and it's a responsibility that falls on everyone involved, from developers to clinicians.
Now, shifting gears a bit, let's talk about the environmental impact of healthcare, something that's often overlooked.
It's a growing concern. Hospitals actually contribute a significant amount to global carbon emissions.
That's alarming. What can be done to address this?
Healthcare providers around the world are starting to prioritize sustainability, but it's a complex challenge.
Especially in places like Australia, where they're also grappling with workforce shortages.
Exactly. It's a balancing act, trying to reduce their environmental footprint while also meeting the growing healthcare needs of the population.
And speaking of Australia, there's some interesting news from the Royal Australian College of General Practitioners.
They've unveiled a plan to make GP care more accessible and affordable for all Australians.
Sounds ambitious. What's their approach?
They're proposing a number of initiatives, including reducing out-of-pocket costs for patients, increasing bulk billing rates, and addressing workforce shortages.
So it's a comprehensive plan that tackles multiple facets of primary care.
Exactly, and they're calling for increased funding to support these initiatives.
What kind of funding are they seeking?
They want to see more investment in longer consultations, mental health services, and extended bulk billing incentives for younger Australians.
It sounds like they're really trying to make a difference in primary care.
They are, and they believe that investing in primary care will ultimately lead to better health outcomes and a more equitable healthcare system overall.
Well, that's a great note to end on. It's encouraging to see such a proactive approach to addressing healthcare challenges.
It is, and it underscores the importance of ongoing dialogue and collaboration in creating a healthcare system that works for everyone.
And it's a rapidly changing landscape for sure, but that's why we're here to break it all down for you make sense of it all.
Absolutely. Our goal is to provide you with the insights you need to stay informed and engaged with the world of healthcare.
Because at the end of the day, it's about ensuring that these advancements, these innovations, actually benefit everyone.
That's the key question, isn't it? With all this progress, are we doing enough to ensure that everyone has access to quality care?
It's a challenge, a responsibility that we can't afford to ignore.
Exactly. We need to be mindful of equity and accessibility every step of the way.
And on that note, we wrap up today's deep dive into the world of healthcare news. Thanks for joining us.
It's been a pleasure. Until next time, stay curious and stay informed. Stacey 89.